the promotional line for the conference is prohibition and public health. Do they go together?
Yeah, at some point, yes, they go together, but I don't think with the same objectives.
How do you mean?
I don't think prohibition it comes in the best interest for public health. As we've seen, as we've known, prohibition it goes the other way, other than getting better at public health, getting people in a better state. We don't see that, or at least in our perspective. In Mexico, Latin America, we've seen prohibition goes to the way to the illicit market, getting more public health issues, and security problems, and a whole bunch of complex situations that I don't think that they meet together in a positive way.
Now, is it true that organized crime, the cartels in Mexico, own the illicit e-cigarette market?
Yes. I mean, they own pretty much, not everything, but a lot of stuff. And they have a big role in the cigarettes. We know 1 out of 4 cigarettes in Mexico come from the illicit market. But now, at least in vaping, 100% comes from the illicit market. So yes, they're getting all over, and the government system is just giving them all and just...
So that must be a consequence of writing a vaping ban into the Constitution.
Into the Constitution, yes. Now it's official in this January, and it puts us in a very complex situations as healthcare professionals, because we cannot even talk about it. We cannot recommend. They say you cannot recommend, promote, or anything about non-combustible products, and that's with big sanctions. I just knew yesterday that I should be more cautious of what I speak on social media with the patients, because someone can say like, hey, that doctor is recommending these safer products as they see it, because they don't go to evidence. I think this decision was made out of ignorance of this precautionary principle that it goes to, okay, we don't know, but what about what we do know, right? So it's a very frustrating point, but coming here and getting very positive stories and successful cases gives us hope to follow that pathway at some point.
Excellent.
We'll see.
Is there prohibition in Colombia?
No, in this moment we have, speak in Spanish. En estos momentos nosotros tenemos en Colombia, no existe prohibición, hay regulación, pero en estos momentos quieren comparar el vapeo, este tipo de alternativas, las quieren comparar con el cigarrillo de combustión. Entonces en estos momentos son impuestos elevadamente altos. Entonces esto permite que las personas que quieren realmente cambiar a una alternativa de menor riesgo en estos momentos, como el vapeo, realmente no lo puedan hacer, o sea, no puedan acceder a este tipo de alternativas. Existen otros vacíos legales, no han hablado de sabores en estos momentos, o sea, no está la parte de que hay una prohibición con sabores o algo, pero sí está de que no podemos vapear en lugares públicos, hay ciertas restricciones, ciertos estigmas, pero en general, como tal, somos de los países que no tienen una prohibición en estos momentos. Trabajamos todos los días por velar de que las personas puedan y conozcan más la información y que no exista tanta desinformación acerca de esta alternativa.